Did you know that bowel cancer is the third most common cancer in the world and the second leading cause of death in the world? Did you also know that this bowel condition affects primarily people above the ages of 50? In today's video, I aim to create awareness on this silent killer. I'll be talking about the early signs and symptoms and the need for an early detection of this condition. My name is Chidera, and I will be presenting to you bowel cancer, the silent killer. Bowel cancer is the cancer that affects your large intestine. It is also known as colorectal cancer. This affects your colon and also your rectum, hence the name it is called colorectal cancer. Now, let me give you a more clearer description of what bowel cancer entails. Bowel cancer arises when there is a growth of a tiny non-cancerous tissue of the lining of your bowel. When this growth is not detected on time, it starts off as non-cancerous, but when it is not detected on time, it could turn into a cancer. It is called a polyp. And that is why early detection is key to nipping this condition in the bud. You may want to ask me, what are the causes of bowel cancer? I want to know what causes this condition. Well, I experience these questions a lot in practice. We would always say there is no single cause for bowel cancer, but there are lots of things that could put you in the path of getting bowel cancer. It is called a predisposing factor or risk factor. Number one factor is age. If you're between the ages of 50 and 74, you could be susceptible to bowel cancer. And that is why there is an NHS bowel cancer screening that requires people within this age bracket to go in for bowel cancer screening. And that is the job I do to help patients go through the process of having this screening called a colonoscopy. The screening is done through testings, investigations, and finally through colonoscopy, putting the camera up your back passage to detect this growth on time. If these growths are detected on time, it could help prevent you from coming down with bowel cancer. A current research shows that what you have in your fridge, which invariably means that what you eat, has a lot of factor it plays in whether you have bowel cancer or not, especially when you have to eat a lot of processed food. The world is flooded with lots of processed food today, and that is why the incidence of bowel cancer is on a very high level. So you must watch out what you eat. Do you take lots of alcohol? Do you exercise regularly? Do you practice a sedentary lifestyle that could predispose you to this condition? Another factor is family history. One of the questions we always ask a patient is there a family history of bowel cancer? Do your mom, do your dad, or anyone in your family lineage have bowel cancer? If the answer is yes, the chances of you having bowel cancer is going to be very high. So you need to also be on the lookout. Also, you need to look at if you have a history of IBD. IBD is the inflammatory bowel disease or the inflammation of your bowel. So if you have any of Crohn's disease or ulcerative colitis, you need to also go in for regular screening to avoid them leading to bowel cancer. Furthermore, we will need to look at the signs and symptoms which needs to be spotted on time to avoid you having bowel cancer. Do not ignore any of these signs and symptoms because they could be potentially signaling that you may be having an early onset of bowel cancer. Number one is passing bright red blood from your back passage or even dark red blood from your back passage. You're also having abdominal pain, which has not gone away for a long time, then you may need to present this to your doctor. If you're having a change in bowel habits, change in bowel habits could either be diarrhea, constipation, or not emptying your bowel properly. If you're having any of this which has not abated over a period of time, maybe you may want to speak to your doctor. Not maybe, you may want to speak to your doctor. This video is to create an awareness for you to understand this silent killer and act fast on these signs and symptoms to avoid it getting to the late stage. I hope I've been able to enlighten you on this condition today, and I hope to speak more to take you more on the journey of your bowel in my subsequent videos. Until I see you next time, please keep taking care of your bowel. Bye bye.